Good morning, good morning, good morning, and happy Friday. Happy Friday, everyone. Yes, it has arrived, and my name is Angela McGowan. I'm your professional healthcare advocate, caregiver strategist, and I'm the author of this book, What You Don't Know Could Kill You, How to Get Out of the Hospital Alive. Yes, and I'm the founder of Angie's Pace. That's patient advocates committed to excellence. So I want to thank you for joining me on this great Friday morning. We have definitely been talking all week about medical errors. That's been our series topic. And we've taken one part of what it is to have a medical error, and that is definitely misdiagnosis, one of the most serious parts of all of it. Let me see if I was trying to do something high tech and it seems like I might have messed something up. Okay, I did it. So look, let me thank you for joining me and let's get right into it. Again, I think I will start out by, I wanted to read the definition of misdiagnosis again, just so we can make sure what's going on for what we've been covering this week. It's from my book. I'll be reading a couple of sections. It says, all Americans will receive a misdiagnosis at least once in their life. The definition of a misdiagnosis is when a patient receives an incorrect medical diagnosis of an illness, and this error can result in a medical issue with the health of the patient becoming poorer during the time it takes to correctly diagnose the patient. So after they fix it, you still might be fighting an uphill battle on your journey to get back to great health, okay? That's just one extra. I have something else we're going to read, but let's get started on medical errors, part 5. So this day we're going to do misdiagnosis or trash can diagnosis. Which is your preference? That's what I put in. What did I put on there? Oh, wonder if you have received one. I put which is your preference. Well, I'm sure I toned it down. All right, but let's kick it back up a notch, okay? I've told you all this week, medical errors is the number 3 killer of all Americans. It is not listed on the CDC list of top 10 for the simple reason that it's not on the death certificate. There's no place to check it. And so the rational minds that run the CDC said, we don't check it. On the death certificate, it really didn't happen like that. That's for another series. Let's keep going, okay? I tell you, regardless of what you're dealing with, you must always have the right primary care physician. That's just, you have to have one. And it is so important because you have to be comfortable to talk to take the advice from, and even to ask questions after the advice is given. You know, it shouldn't be, the physician should not feel challenged or that you don't value their years of study or their opinion, or no, you are valuing your life and that of, and the lifestyle you have, and what the domino effect, right, that it'll have on your family if you are not at your best. So yes, you have a perfect right to ask questions. A powerful patient is always going to ask not only questions, not just the right questions, also going to ask the hard questions. A powerful patient is positive, persistent, prepared, passionate, and on purpose, all right? And what are some of those hard questions like, is this the only treatment? Are there alternative treatments? Is there something else that could give the same result, even if the timeline's a little different? All right, and every person who's a patient, how about that one, that receives any type of diagnosis, and for some reason on the inside of you, it's like, this is like charade, sounds like, but it's not it. You should not hesitate to use these 5 words. Could it be something else? Yes, it could be something else. As we have found all this week with the variety of misdiagnosis, failure to diagnose, delayed diagnosis, and now today with the trash can diagnosis. Okay, so yes, those 5 words are very, very important. Use them. Okay, and say it confidently and with conviction. Yes. So this week we've covered a lot. Like I said, the medical errors, misdiagnosis, MISSED diagnosis, the big 6 effect, okay, the domino effect of a misdiagnosis, mass diagnosis, failure to diagnose, and now, of course, we're doing the trash can diagnosis. We also learned that 10 to, okay, every time, but it's okay, 10 to 30% of diagnoses that are given out point blank are misdiagnoses. Okay, that's just what goes on in America. And that information came from the Agency for Healthcare Research and Quality. In emergency rooms, 40% of the diagnoses that are given in emergency rooms are considered to be misdiagnosed. Hey, Miss Erica, thanks for joining. Okay, so in my book, let me read one more part in the book regarding in the mismasked and misdiagnosis. All right, do you need a little confirmation about how people actually move forward in being misdiagnosed? How does that happen? It is an extremely common event to have a patient just seconds out of the emergency room or either out of the examining room with the doctor to ask the nurses or even the administrative staff for the answers to questions that they should have both requested and received from the physician. Again, why does this happen so often? Generally because these patients have agreed to have a procedure or an invasive test without having clarity and complete understanding of what it will involve, because there is no time allotted for it during the exam period. You got to make time. We talked yesterday, right, that it was 25 seconds, but every 11 seconds, your doctor is redirecting you back to what he or she wants to talk about. So as a powerful patient that is prepared, you go in there with your situation, your questions, your symptoms written down. You can break it into this every 11 seconds if you want to. I just put my finger on the next thing I said. And what I was saying was, or this is what I tell my clients. If this interruption happens more than once, so you know what, doctor, can you just let me finish making these requests or telling you about these symptoms, and then we can, talk about it together. You can give me the answers, because I think if you hear what's really wrong, then of course the opinion, the advice you give me back is going to be complete. Okay, yeah. Stand your ground. Come on, come on. So today we're going to end the week with the trash can diagnosis, also called a fake diagnosis. All right, trash can diagnosis. Sometimes, and we touched on this a little bit yesterday, rather than provide no name at all about all the symptoms that may be happening, okay? A doctor can not give you a diagnosis, but give you a label, like call it something, like as if it's a real diagnosis, but just tell you it sounds like, or you're in the category, you're in the group that suffers from. So it can range from something as simple as, or descriptive, like some type of reactive things that you get from hypoglycemia, like you're always hungry, all right? Or something that would describe your symptoms of fatigue or headache and depression. And then there's one reason why doctors do this, okay? Because we as patients, we want a name of something. We don't want to, just be sick, my stomach, my head, my leg. No, we want to call it something, all right? But these labels, not diagnosis, these labels, okay, are not what's wrong with us in the first place, okay? They are just simply a label that is like typecasting the family of it, or it could be this, it could be that. We want to understand that these labels are not going to help you get the right treatment. All right, every human body is so different. We've been uniquely made. So we could both have the same label, but because our lives, our lifestyles, our age, gender, body type, all of that is different, these symptoms that I'm having or you may be having don't describe actually what is going on in our body. So sometimes the doctor will just make up something, especially if you are a patient that is persistent and just wants to know what's going on, or might have read something, WebMD, Google, whatever. So they think when they invent this label, okay, that sounds very official, it covers up what? Their inability to satisfy you as a patient and their inability to make the diagnosis. So if you've been given some unusual diagnosis and it's very rare and nobody knows about it, or the label, it doesn't sound like Sheree sounds like, okay? What it's called is a trash can diagnosis, or we probably call it a fake diagnosis. All right. So let's talk about the trash can diagnosis. How did that evolve? And what happens with trash can diagnosis? Sometimes, okay, the need to give a label, all right, enough people talking about those symptoms, it actually becomes a bona fide clinical situation. Case in point, fibromyalgia. It was originally used as a label to describe chronic generalized pain, because with fibromyalgia, the pain is not in one place. It could be a very, very bad pain, but it can manifest in different areas of the body. So that was just a label. That was just like, okay, that's probably what another one that started as a trash can diagnosis, but because of powerful patients and people insisting like, no, I'm going to need more information. I'm going to need what you said. It's not working. It's something called gastroesophageal reflux. Okay. We call it acid reflux, but it's also known as GERD. I remember years ago, people talking, I have GERD. I'm like, what is that? But of course that, but people wouldn't say gastroesophageal reflux disease. They just say, oh, it's GERD. Oh, my GERD. I got GERD today. I wasn't getting it. But now guess what? Because of powerful patience, because of persistence and being prepared and saying like, nope, that didn't work. There has to be something. Not only is GERD considered a disease, a legitimate diagnosis, there are several medications that pharmaceutical companies were required to get it together on, and now you have medications for that. Okay? So what happens with some of these trash can diagnoses or fake diagnoses? They treat them even medically, okay? Not medically, in a pharmaceutical way, the same way they do medically. So they give you clinical trials, and guess what? You go up there and you get a placebo. That's right. You're on a research drug, but you don't never know if you got it or not. That's part of the clinical trials. But there are people who are getting placebos and they are reacting and they're feeling better because they're simply getting treatment. They're simply getting an answer. They are going to the doctor on specific days and lab work's being done and they're seeing the doctor and, they're talking about, well, we're going to adjust. I'm just letting you know that is considered therapeutic value. But I say it is called what? Deception. Because the person doesn't know this clinical trial. Okay, I may or may not get it, but they also don't know that I'm not even fit for this clinical trial because what it's doing, I don't even have. Or I have maybe one symptom, but I don't have the barrage of symptoms. So that's why you have pharmaceutical drugs that go through a clinical trial, okay? And then a year or two later, all of these people have something wrong because of these trash can diagnoses, this trash can treatment, and this trash can plan of care that's being given out. So diagnosis, when it's missed, when it is delayed, when it is done wrong, when it is faked, okay, that ends up with these kind of bogus treatments. And patients become even sicker, all right? Misdiagnosis and all these other medical errors, basically, they can lead to wrong treatment or long-term illness or even death. So understanding as patients all the difficulties that we face. We need an accurate diagnosis. And so we can see what is going on with, and it is important that we confirm we have the right diagnosis. Now, how can that be done? You and I, both of us, okay, all of us, we have to request and require a second opinion. If you think the diagnosis is right and after taking a medication is not working, you need to get a second opinion. While we're usually invited to wait 6 months, 6 weeks, whatever, though that time can totally change the trajectory of our lives from something that could have gotten better in a few months to something that will not get better even in a few years. And we now are we are now suffering, and our ability to do things has lessened. So we definitely don't want to do that. So second opinion should be a must on your list, especially if you don't feel that confidence in your doctor. And if you don't, of course, I'm telling you, change right away. So let's not forget that for both men and women, when it comes to the most common misdiagnosis, okay, it's heart attacks, appendix, breast cancer, colorectal cancer, and lung cancer. And of those, heart disease is the #1 killer of men and women, and breast cancer is the #2 killer on the CDC list, okay? Because I know men do have breast cancer as well. So what are we going to do? How can we respond? First of all, regardless, we're going to stop with time of indecision. We're not going to let weeks go by before we decide about a second opinion or to take a treatment or to take a medication. We're not going to do that. Okay, we're going to stop having this false sense of loyalty. Well, the doctors the doctors are all practicing medicine. Don't forget that. And #3, we're not going to be afraid to confirm our diagnosis with an immediate second opinion. Because I said it, if your doctor is wrong or is not giving you the best treatment, when they finish that appointment, at the end of the day, they go home to their family and they continue. You will not have the same ability to continue in the way that you want to, okay? Misdiagnosis, failure, trash can diagnosis, they affect your care. They affect the medications you do or do not get. They affect your family and the lifestyle your family has, affects your finances, and it affects your future. So documentation of your symptoms is always a must. Always go in there prepared for your appointment, whether it's for your PCP, your specialist, whatever provider. Because excellent health care, as I always tell you, it is not a privilege, it's your absolute right. You need to exercise your right, and you need to be responsible. It is definitely your responsibility to make sure that your voice is heard. And if you feel your voice is not heard, I put in the comments section, if you feel that you're not getting the results you need, you can contact me at the bit.ly link. That's Advocate Angie. You can always go to my website, see the things we offer, and I invite you to please be a part of our free Facebook membership group, the Powerful Patient Movement. We are talking about these things in depth. We're going to have workshops in there, and we'd love for you to be there and to be a part of it. Now, on next week, we're going to be discussing minority mental health awareness. Okay, that's this month, and we're going to end up the month with that. So I want to thank you for joining me. This is our last broadcast for this week. And on Sunday, I'd love for you to also join me for, did I put that in there? I don't think I did. So here's all the things you can do on Sunday at 5:30 p.m. Okay, Facebook Live. I thought I had pre-done this too. Okay, well, anyway, every Sunday at 5:30 p.m. you can join me on Say It Sunday. We're going to be talking about medications. We've been doing this all week. We're going to be talking about some medications that as seniors you should not, and they're over-the-counter drugs, some of them, some that you should not run to, but you should definitely get medical advice on, especially if you have blood pressure and other things like that going on. All right, I'm Angela McGowan, your professional healthcare advocate, caregiver strategist, author and publisher of What You Don't Know Could Kill You, How to Get Out of the Hospital Alive. And I help you navigate through healthcare's sea of red tape, creating strategies that will allow you to give excellent care to those that you love and care for as you care for yourself as well. So thank you for joining me. Have a blessed, wonderful weekend. Be safe out there. I'm leaving you with what? Those two things. Blessings and joy. Why is that? They all both belong to you. Have a blessed time. Take care. See you on Sunday at 5:30 for Say It Sunday. Bye.